बिस्मिल्लाहिर्रहमानिर्रहीम। जी बेटे स्टार्ट करें। हेलो
सर स्टूडेंट म्यूट है,
जी सर।
म्यूट कयो सर।
हेलो मां अनम्यूट करे तो ॿुधायां थो। हेलो
जी
हेलो
सर। यस सर।
स्टार्ट करें।
जी
यस
सर।
सर।
लेक्चर स्टार्ट करें। अ- अ- अच्छा जी। लेक अब म्यूट कर लेते हैं। स्टार्ट कर लेते हैं। We start from the introduction of the eye. Just like Bismillahirrahmanirrahim, I work like an ordinary camera, which is rather is mobile sphere shaped structure suspended in the orbit. In eye, pupil regulate the amount of light entering the eye like is the shutter of the camera. Cornea and crystalline lens focus the rays of the light like is ordinary lens of the camera. And they focus on the retina, which one is the film of the camera, to form an inverted image or a picture which is then transmitted to the brain by the optic nerve as a coded message through the optic nerve for final evaluation. So the just like eyeball working is ordinary camera, no? Rays coming from infinity, coming from the object, focus on the retina which is inverted, and it transmitted through the optic nerve, and the brain has a ability to erect or normal the position of the object. So the eye work is a camera, no? You know what the capacity of the seeing capacity, it has a power of the brain, occipital cortex, which receive the message of the image which form on the retina. You know what this picture show, that is the object which form on the retina, which even is inverted, no, object, inverted object, and is transmitted through the optic nerve, and the brain has a ability to normal the object. So this is the, you know what the orbit, it has got is four boundaries, no, medial wall, lateral wall, and is roof and floor. So medial wall has a got is four bone, and is a lateral wall, it has got is a two bone, roof it has got a two bone, and floor it has got a three bone. So you remember that is a very easy note, easy to remember, because of your second year students, and then the second year, second in near future you pass the second year, and skull, it was discussed in the second year, head and neck. Oh. So orbit, you understand the orbit, the medial wall of the orbit, it has got four bone. It starts from the anterior to posterior. Anterior maxillary bone. Number two, after that is uh, the lacrimal bone, ethmoid bone, and body of sphenoid. There's four bones at the medial wall. So at the medial wall there is the lacrimal fossa. Lacrimal fossa, which form anterior in between the anterior lacrimal crest and the posterior lacrimal crest. So anterior lacrimal crest is formed by the maxillary bone, and posterior lacrimal crest formed by the lacrimal bone. So in this fossa, there is a lacrimal sac is present, lacrimal sac, which collect the tear film, flood of tear film through that is puncta and canaliculi and drain in the lacrimal sac. Here is collection of the tear film and drain uh, through the nasolacrimal duct into the inferior meatus. So this is at the medial wall, the space in between the anterior posterior lacrimal crest is the lacrimal fossa. Importance here is the lacrimal fossa. Now, how it form lacrimal fossa? So anterior and posterior lacrimal crest. So four bone is the medial wall, no, and three bone in the floor of orbit. So medially, the maxillary bone, laterally, the zygomatic bone, and inferior and posteriorly, the palatine bone. So palatine, you must see that example of the palate, palatine bone plate. You know, in the plate, whatever was put on the plate is below that is the material we put on the plate, no, palatine bone. So inferiorly, floor is formed the mainly is palatine bone, but is anteriorly at the medial side the maxillary bone and lateral side zygomatic bone. So two bones contribute to form the roof and lateral wall. Roof is anteriorly is a frontal bone and posteriorly the lesser wing of a sphenoid. And lateral wall is formed by the two bone, anteriorly by the zygomatic bone and posteriorly by the greater wing of a sphenoid. This is easy to remember. Very easy to remember. Four bone in the medial wall, three bone in the floor, two bone the lateral wall, and two bone the roof. So this is orbit. You know what the orbit is? A pear-shaped cavity which lodge the eyeball and adjacent structure like muscles and other structures adjacent to structures in the orbit. So this was the discuss lateral wall, floor, medial wall, and there is a two fissure. No, look at the that there is in the uh, means orbit the skull. You remember the skull. You have studied the skull. There is opening of the communication of the orbit with the other intracranially and extracranially. So intracranially, the communication, major communication, the superior orbital fissure and optic canal, which communicate with the middle cranial fossa, and is the inferior orbital fissure, which is communicate the extracranially with the pterygopalatine fossa. Pterygopalatine fossa. So the communication of orbit with intracranially and extracranially. Where there is the superior orbital fissure, what are the structure pass through this orbital fissure? Lacrimal, frontal, and trochlear nerve, which pass through this the superior at the portion superior portion of the superior orbital fissure. So and other is the superior ophthalmic vein. These structures pass is the superior portion. An inferior portion of the orbital fissure, there is the superior and inferior deviation of the oculomotor nerve. You know what the oculomotor nerve when passed through the orbital fissure is divided into two deviation, upper deviation and lower deviation. Upper deviation is supplied to the superior rectus, medial rectus. So and inferior deviation is supplied to the inferior rectus and inferior oblique. So this is uh, there are two deviation. No, oh sorry, there is two deviation. Upper deviation, upper deviation is supplied to superior rectus and levator papillary superior. Inferior deviation is supplied to the medial rectus, and inferior oblique. Sorry, you correct this one. Upper deviation is supplied to the two muscles. One is extraocular muscle, which is superior orbital superior rectus, and as one is the lid muscle, the levator pectoris superior muscle. So inferior devian is supplied to the three muscles: medial rectus, inferior rectus, and inferior oblique. So, and other is the abducent nerve. And abducent nerve, you know what the abducent nerve is supplied to the lateral rectus. And a nasociliary nerve, which is nasociliary nerve is the branch of the afferent deviation of the trigeminal nerve. So nasociliary is sensory supply to the eye structures. And other is the sympathetic nerves also transmit also pass through the inferior deviant, inferior portion of the superior orbital fissure. So here look at the eyeball, and you know what the eyeball it has got is the segment and chamber. You remember first the segment and chamber and layers of eyeball. So eyeball it has got is the three layers or three coats. Uh, that is external coat, which one is the fibrous coat. External coat is the fibrous coat. This one is the fibrous coat, and this fibrous coat is consists of the cornea and sclera. This cornea and sclera, and other is the middle coat. Middle coat is consist of the uval tract, iris, ciliary body, and choroid. And third coat is the inner coat, which is the nervous coat, which one is the retina. So eyeball it has got three coats or three layers. So outer is fibrous coat, middle is the uval or vascular coat, and inner is nervous coat. So fibrous coat is the contribution of the fibrous coat. This is the cornea. This cornea is contribute the 5/6 part of the outer coat. 5/6 part. Uh, one uh, 1/6 part, and 5/6 part is the sclera. So 1/6 part, this one is the cornea, and 5/6 part of the sclera is the major portion of the sclera. So other is the middle coat is consist of the this iris, ciliary body, and choroid, and nervous coat is the retina. So chambers, you know what the chambers segment is a two segment, anterior segment and posterior segment. Anterior segment is consist of the anterior chamber and posterior chamber, and this is the two chamber contained by the anterior segment. So and posterior segment is consist of the vitreous chamber. So vitreous, along with the vitreous, we come and note that there's a posterior segment. So there is three chambers: anterior chamber, posterior chamber come in the anterior segment, and vitreous chamber is come in the posterior segment. So look at the anterior chamber. Anteriorly the posterior surface of the cornea, and posteriorly the anterior surface of iris, and the center is the pupil. This is space is about is 2.5 millimeter, and it contains the 0.3 cc of ml of the aqueous. And posterior chamber is a transient space in between the lens and this iris. This one is contain the aqueous and also lens. So posterior chamber boundary is the posterior surface of iris and anterior surface of the vitreous, which patellar fossa. So this is posterior chamber. Lens is contained by the posterior chamber of anterior segment. This lens is contained by the posterior chamber of the posterior chamber of anterior segment. So up to pars ciliary body, it has got two portions: pars palatica and pars plana. So pars pletica, this one about this one is the pars pletica, and this one is the pars plana, and this is ora serrata. The ora serrata is point in between the ciliary body and choroid. So this is a pars pletica part is come in the anterior segment. Pars plana part is come in the posterior segment. So pars plana part of the ciliary body for intervention of the surgical intervention of the posterior segment. We can inject, we can do the surgery by this portion. We make a hole, make a hole, and there is a passage from this pars plana part of the ciliary body. So eyelid, you know what the eyelid means? First, you know what the eye? Eye. We have a two eyes, you know. We have
Excuse
a
me, sir.
okay.
Sir, the slides are not changing.
Slide is not changing.
No, sir, it's on superior orbital fissure.
So not hair is changed. You know, okay,
Sir,
this one. Okay.
sir,
So
they are changing.
no changing.
Sir, they are
No,
changing on
sir.
my laptop. Sir, they are changing.
Changing. So
Yes,
you
sir,
look at
you may have an internet issue.
yes, a little bit the signal issue is there, no? And eyeball, you know what the eyeball? We have a two eye, no? We have a two eye. And what is the importance of two eyes? And importance of the five importance of the two eyes. You know what the five importance of the two eyes? Why we have a two eyes? One is the two eyes have a three-dimension picture. Three-dimension picture means a stereopsis. Stereopsis. You know what is stereopsis? Single binocular vision. Single binocular vision, one important. The two eyes come to focus in one object and we get is the depth of the focus, breadth and length of focus, whatever the three-dimension picture we get is three-dimension picture by the this two eyes. One important the single binocular vision. Number two is broad visual field. You know what the visual field? Broad visual field. We look at if you get one eye closed and you look at the visual field. You know what the normal visual field. Now temporally, what happened temporally? How much visual field in degree? 90 degree. Inferior there is a 70 degree. Nasal there is 60 degree, and above is 50 degree. This is the round about the visual field. What is the visual field? Visual field is the island of the vision surrounded by the sea of darkness. Island, we look at the island, but is beyond the island, we can't see. It's a darkness. That's the visual field, the island of the vision surrounded by the sea of darkness. And normal visual field, we calculate in the degrees. You know what degrees? Temporally, how much degree? 90. Inferiorly, 70. Nasally 50 degree, 60 degree, and above is 50 degree. So you differentiate the visual field from the visual acuity. So what is the visual acuity? The visual acuity is the resolving power of eye to discriminate so visual field, you know what? Okay, you get my point? Hello?
No, sir, please repeat it.
Uh, there is signal drops, no? Okay. Huh? Let me achieve the phone achieve phone the connector. Now, yeah, it is okay. Now it is okay, Maria.
Yes, sir.
Hello.
Yes, sir.
No.
Yes, sir, it's okay now.
Yes, sir. You learn is these are the important points: visual field and visual acuity. We ask from what is visual acuity, what is visual field. Visual acuity is the resolving power of eye to discriminate or to differentiate the two objects at particular distance. This is the visual field, resolving power of ability of eye. And visual field, what is the visual field? Is the island of the vision surrounded by sea of darkness. There's a differentiation point, no? So visual field, visual acuity, you know what? Visual acuity, we have a normal visual, how much normal visual acuity? 6 by 6. You know what 6 by 6? Okay? What is 6 by 6? 6 meter by 6 meter. We stand the patient, a person at 6 meter, and saline chart is away from the person 6 meter away. And that is a 6 meter line. We get a 6 meter line. Uh, that 6 meter line form the visual axis at the nodal point. Visual 5-minute arc angle axis angle at the nodal point, that is normal visual acuity. So we discussed the visual acuity in detail in the your classes because of the posting, because of the there is a 4 important topics we will discuss in the your posting. Number one is the visual acuity. What is visual acuity? How to take the visual acuity? What is the concept of the visual acuity? And number two is the confrontation test, means the visual field confrontation test. How to check manually visual field. And third one is ocular motility. Ocular motility, we calculate the ocular motility in order to the paralysis of the nerve, which affect the extraocular muscle. So visual field, ocular motility. And fourth point or fourth thing we will discuss in the your posting, that the ophthalmoscopy. The 4 points were discussed. Though our group has completed the discuss in the posting the 4 points. These are the ophthalmoscopy, visual acuity, confrontation test, and visual field, and ocular motility. So this visual field, visual you learn visual field. Normal visual field is 6 by 6, means in the meter, but in the feet 20 by 20. So this is normal visual acuity. And normal visual field, you need the calculate in the degree 90, 70, 60, and 50 degree. So you start from the temporally. So you get my point? Okay? Hello? Mumal?
Yes, sir.
So,
Yes, sir.
yeah, okay. The 2 points we discussed now. One is single binocular vision, why we have a two eyes. The importance of two eyes. One is the one is the okay, Saima. One is the single binocular vision. Okay. Number two, wide visual field. Number three, the overlapping of the blind spot. You know what the overlapping of blind spot? What is the overlapping of blind spot? Who one tell me overlapping of the blind spot? What is the normal blind spot? Maria,
Optic
Maria,
disc.
Sir,
Hafsa,
optic disc. Optic disc.
Optic
optic
disc
disc,
is a normal
optic disc.
blind.
Normally
Very,
optic.
very good. Why the it display? Why the display is the blind spot by the optic disc? Because of there is a no photoreceptor cell present, no receptors present. No, so and we get if we with one eye we close the one eye and we get the normal blind spot. It is your 15 degree temporally. 15 degree temporally. 12 to 15 degree temporally you get is the missing point in your object if
Yeah.
you hold the object. So this is a blind spot. The property of the two eyes is overlapping a blind spot. Number four is choice. If you when the one have a lost one eye, other eye can work is properly, choice. And fifth thing is the cosmetic. Cosmetic is very important. You know what the one eye there is cosmetically disincompetence and not acceptable. No, it look like is not better. Two eyes is very good appearance, very good that cosmetic appearance. So there is 4 points. Who one tell me, Maria, 5 point? You tell me the 5 points. Maria.
Yes, sir. The first
Maria.
yes, sir.
First.
सर मतलब 5 पॉइंट की ये कि सर थ्री डायमेंशनल पिक्चर हम देखते हैं टू
ये क्या
सर
ये क्या हो
सेकंड
रहा है?
ये हमारे पास ब्रॉड विजुअल फील्ड है सर
हाँ.
और ब्लाइंड स्पॉट
Think.
होगा और फोर्थ में
हाँ.
सर हम
Choice.
मैथमेटिक्स के लिए हमारी है 5 में
Choice.
ये कि 5 में ये
Choice.
सर अगर मतलब एक हमारी मतलब पर्सन की अगर खराब हो जाती है तो दूसरी से भी अगर ब्लाइंड हो जाता है तो दूसरी से वो अपना काम मतलब चला सकता है
हाँ. Choice और पांचवी जो है ना कॉस्मेटिक. हाँ. Single binocular vision, broad
सर
visual field. Third one, that is the choice. Choice one eye you not get lost, and the other is can work. Yeah? Choice and oh, the five importance. No, overlapping of blind spot
यस
and
सर
cosmetic. Take it. Yes, Hafsa, you can discuss 5 point. Hafsa, Hafsa, Saima, Saima,
Yes, sir.
Saima, you can tell me the 5 points. Single binocular vision, number one. Number two, Saima, single binocular vision, broad visual field, overlapping of blind spot. Four point is choice, and fifth
Choice
point
of the
is cosmetic.
cosmetic.
ये सही नहीं आ रहा ना. अच्छा चलो. Now this look at is the this one is the eyelid. You know eyelid. Eyelid it has got a 5 layers. How many? 5 layers. Uh,
5 years
outer one is the skin, and second layer. Sec, second is the loose aerial tissue. Third one is the this one is the you know what we call it is the look at this one is the muscle no orbital oculi muscle this third layer no unstable yes okay अभी ठीक है connection हाँ this skin loose oral tissue this one is the muscle and this muscle this orbiculus oculi muscle and this muscle you know what like this muscle come from upside and insert over the tarsal plate and the अब माँ लेक्चर तो बटा आपको बाद में ठीक है लेक्चर तो बटा माँ this is skin, loose oral tissue, muscular layer, and this muscle. You know what? How many muscles? How many muscles? This muscle is orbicular muscle. This one is levator pulpit superior muscle, and levator pulpit superior muscle is insert over the you know, a maximum fibers over the upper portion of the that is tarsal plate, and few fibers come penetrate through the orbicular muscle and insert over the skin and form the that is the in the lid crease. You know what lid crease formed by the few fibers come from the that is levator papillary superior muscle and insert it over the skin is formed the lid crease. Normally you look at your lid, there is crease formation, and crease formation due to that is insertion of these few fibers of levator papillary superior muscle. And you know what look at is that this one muscle inferior to levator papillary superior muscle and insert over the upper portion of the tarsal plate, which is the Muller muscle. And you know what the Muller muscle, you know the Muller muscle is supplied by the sympathetic. And the levator papillary superior muscle is supplied by the oculomotor nerve, oculomotor third nerve, no? And this one is the Orbicular muscle is supplied by the Maria. Supplied by
Oculomotor.
Yes, sir.
orbicular muscle is supplied by the
Oculomotor.
no. Ocular muscle is supplied by the facial nerve.
Facial nerve, sir.
Sure.
Facial nerve. And levator papillary superior muscle is supplied by the oculomotor nerve.
Oculomotor.
And
Yes, sir.
this one is the inferior muscle, inferior to the levator papillary superior muscle, that is the molar muscle, and it is supplied by the sympathetic. You know what
Sympathetic.
sympathetic means? आवाज आ रही है?
Yes, sir.
अच्छा. So
Yes, sir.
fourth layer from outer to inner, fourth layer is tarsal plate, and fifth layer, you know what the fifth layer is, the mucous membrane, which is conjunctiva. So the five layer lid, it has got a five layer from the outer to inner: skin, loose oral tissue, and
Muscle.
muscular layer, dorsal plate,
Oculars.
Conjunctiva.
Mucous membrane.
Mucous membranes.
and mucous membrane, the conjunctiva. Okay, I function. How many function of the how many function? How many function of the lid? There is five function. No,
5.
one is the protection. Eyelid protect the eyeball. Okay, number one. Number one. अरे मैं लेक्चर तो उठा आपको गला जो ठीक है. Number two, the spreading of the tear film or the anterior surface of the eyeball. And third function, it is secrete the tear film, which one outer layer. You know what the tear film? It has got three layers. Outer layer is the which one is the lipid layer, and oily layer, which is the outermost layer. Middle layer is aqueous layer. Inner layer is mucin layer, mucus layer. So three layers of the tear film. So eyelid margin, it form the outer layer. You know the outer layer of the tear film by the Zeiss gland, by the gland of the mole and the meibomian gland. These meibomian gland or these lid margin gland is secrete the outer layer of the tear film. Okay. Third function, formation. And
Sir.
fourth function, fourth function is the of eyelid is fourth function is the drainage of the tear film. When we close the eyeball, what happens? Negative pressure and tear come in the lacus, your medial side pe tear, that one is drained through the puncti and come in the lacrimal sac. And when we open the eye, that is causes a positive pressure and stretch over the lacrimal sac and drain whatever the collection in the lacrimal sac come through the nasolacrimal duct in the inferior meatus. So positive and negative pressure in order to drain the tear film by the lid. That is the fourth function. Fifth function is the cosmetic. You know what cosmetic is important. So today we discuss these are three structures, and there is five lectures. One lecture is 2 days completed, and remaining is four lectures. In order to, if you demand increase the lecture, we increase the lecture in order to understand the anatomy, physio, little bit anatomy, physio, and error of refraction. At your class up to third year class, there is a we have a syllabus like is anatomy, physio, and error of refraction. Any question from your side, Maria?
Sir, sir,
Yes.
Sir.
sir,
Yeah.
can you please repeat the
Sir, can
functions
you
of
tell?
eyelid again?
Function of the eyelid. Function
Yes,
of the
sir.
eyelid. Function of the eyelid is one is protection.
Yes,
When
sir.
you from the external injury, from the external source, in the wind or in trauma, you close the eye in order to protection. Number one. Number two, spreading of the tear. Spreading of the tear when you close the eye. Spreading of tear over the entire surface of eyeball is form the layer over the entire surface in order to moisten the cornea and sclera. If there is not moistening, not spreading, what happens? Dry may lead to that is the thinning and ulcer of the cornea. So the closing of eyelid is blissing thing. Na? Normally what happen in 1 minute we get is the 14 minute spontaneous blinking. Spontaneous blinking. 14 time per minute. 14 time per minute. Okay? So it's
Yes,
normally.
sir.
And third function is the outer layer of the tear film is get secret from the eyelid margin. Fourth function Fourth function is drainage of the tear by the creating positive and negative pressure. And fifth is cosmetic. Cosmetic is important now. The cosmetic, the five function. Any question, Tuba?
Sir,
Yeah,
sir, can you tell me, sir,
yeah. What you what you want?
sir,
What is
can you repeat the layers of tear film?
tear film? It has got three layer, no? Three layer. Outer layer is lipid layer, which is oily layer. Middle layer is aqueous layer, which is thick layer, aqueous watery layer, aqueous layer, and inner is mucin layer, mucoid layer, mucus layer, or secreted by the goblet cells. Three layers of tear film. We discuss it later on, no? Okay?
Sir,
Thank
sir,
you, sir.
sir.
Okay. What is the other question?
Yes, sir. You talked about the difference of pressure, the negative and positive pressure in the fourth one. Can you
Ah,
please elaborate it?
negative pressure. You say your eyelid get closed. There is a negative pressure, and puncti is approximation of what are the collection of the tear at the medial side, lacquers. There is drain. There are two functions. One is the capillary attraction by the puncti. The tear drain through puncti and come in the lacrimal sac is negative pressure. Positive pressure when you open the eye, it creates the positive stretches over the lacrimal sac at positive pressure and drain the tear from the lacrimal sac into through the nasolabial duct into the inferior meatus. Okay, positive pressure. Open the eye, get the positive pressure. Close the eye, you negative pressure. Drain the tear in the lacrimal sac. Okay. What are your question, Anand? Yes. What are the question? हाँ भाई अभी
Sir, sir,
हाँ
do you know about the result of second year? The
हाँ
exam result. When will it be out?
रिजल्ट दे देंगे आपको मसला नहीं
Okay,
रिजल्ट जो है ना आ जाएगा हम चाह रहे हैं
all.
कि रिजल्ट आपका अच्छा आ जाए ना
Inshallah, sir. Thank you.
ठीक है
Yes, sir. Yes, sir.
कोई एनी क्वेश्चन हाँ भाई
No, sir.
हाउ मेनी स्टूडेंट्स कितने स्टूडेंट्स हैं कितने स्टूडेंट आ गए 164 your strength is 250
Yes, sir.
your
Yes, sir.
cla- your class strength is 250 out of 250 is 160 है 160 है
241, sir.
Sir, 241.
241 is there but is attendance here is attendance your mark attendance 160 165 now 164
Yes, sir.
okay Iman what do you what is your question Iman now finish so next lecture also we continue this one introduction you get introduction is important broadly thing you keep in your mind and then micro things and detail we discuss in the fourth year. No, okay.
Yes, sir.
Tuba,
Sir.
Noor,
Yes, sir. Everything is clear.
Adisa, Iman.
Yes.
Okay.
Yes, sir.
Yes.
Yes,
Any
sir.
any
Sir.
any question? Any foreigner from the Sri Lankan? Sri Lanka. There is Sri Lankan students there. Sri Lankan students. No, कोई नहीं है
Yes, sir,
श्रीलंका
we
के.
are here.
Yeah.
Yes, sir, we are present.
अच्छा. Fatima. Fatima, you are Sri Lankan?
Yes, sir.
Okay. Okay. खुदा हाफिज. खुदा हाफिज.
अल्लाह हाफिज.
Allah.
अल्लाह
Okay, Allah
Thank you.
Hafiz.
अल्लाह.
Last